just get you all to sign in. I'll just get you all to sign in for today's session. So we're doing today's session, it'll be on manual handling. I'll just get you all to sign in first. Don't worry about you. Thank you very much. Thank you. So Mary Ann, I'm one of the SDNs working at Bentley. So the session today would mainly focus on utilizing a slide sheet on someone who really doesn't want to move and also doing a rescue pod when there is an emergency. So before we get started, I just want to orient you to the place. So just to tell you about the fire exit in case there's a fire. So you just have to go out through the doors, turn left, and it'll just be the car park which is out closer to the reception. But I will guide you all in the event of a fire. If you'll need to grab a coffee or anything, it's just to the left again. The dining area is just to the corner there. And if you need the toilets, it's out through the door, turn right, turn left again. The toilets are just in the corridor over there. But if you'll need anything, if you'll need a break or anything, please let me know during the session. So pretty much what we're discussing, has anyone got any injuries I need to be aware of before we go ahead? But during the procedures, if there's any problems, do let me know. You can just stand back and watch and then continue. We can just continue. I can reassess on a different date. So, what kind of, so we normally use a SAM approach. Quite close the door.
What do you want to say that?
It's just a little bit noisy, so you can continue. That's all right. You can continue. I might just close the door. Sorry about the noise. So normally when we take on a shift and we sort of like take a handover, what we need to do is we need to assess what kind of risks we have, it happens in the ward. What kind of risks are we looking at? Patients. The patients are a risk. What else could be risks? Equipments we use, there could be spills on the floor, and it could also be all the connections your patient's got. So there's so many risks associated when you start a shift. So pretty much what we do is we use what you call as a SAM approach to assess the risks. What kind of changes can we do? How bad the risks are to us? And how do you go back and follow up and monitor the changes? So that's what we need to do with every little task we do. We need to try and use a SAM approach to make it safe for us and safe for the patient as well. So with the SAM approach, we use spotting the hazards, which we've identified at the moment. And it could also be, you could be having a bariatric patient, like how we have currently in Ward 5. We've got someone who weighs around 130 kilograms. So what we need to check is how mobile is your patient? How much can they help you? Have we got the right equipment? Have we got the right bariatric equipment? Are they sitting in the right room? Are they sitting in a bariatric room? So those are the kinds of things I would start as assessing even before I get to the task. And have I got the right number of people or the right people trained to help me with this task? Or am I the only senior person with a whole lot of juniors in the ward? So do I need to call up my manager? Do I need to call up the safe team? Or do I need to just call up my neighboring ward and say, can someone come and help me with this? Can I call up the physios? So those are the things I would start assessing before I even get to the task. So once I've spotted the hazard, then I would like to assess and see what kind of risk is this hazard causing me. So that's when we look into the matrix. It's a WA Health Manual Task Risk Level Matrix. It's pretty much the task, what kind of a risk is that causing to me? Is that going to be or to me or my patient? Is that going to be catastrophic? Is it going to be major, moderate, minor, or insignificant? So that tells you what kind of injury can happen to you. How often am I having to do this task? How many times will I have to move my patient up and down? So how likely it is. That will determine what kind of a risk that's contributing. Is that a high level risk, an extreme risk, or a medium risk? So once I've identified what kind of a risk is this contributing, once I've identified the risk, then what I need to do is make the necessary changes to try and reduce the risk from an extreme to a high, to a medium, or to a low. Ideally, I would like my patient just to go out the bed on their own. Ideally, I would like for them to just get out of the bed on their own. But what changes can I make to try and reduce the risks? So that's where we come into the hierarchy of control. Sorry, I'm trying to simplify this, but if it's getting complicated, please let me know. So I'm just trying to make the changes to try and reduce the risk. I would never like to do a task when it's sitting at an extreme level of risk. I would really like to make the necessary changes to try and reduce the risk down. So in the hierarchy of control, you've got level 1, level 2, and level 3. Under level 1, as I have said, I would like to eliminate the hazard altogether. Can I use sort of like maybe the bed, or can I encourage the patient to just sort of like maybe hold on to the bedside rails and try and push themselves up? Can they bend their knees to try and help themselves up? So I'm trying to eliminate the hazard. But again, have you got a spill on the floor which could be removed? So those kind of things. So we're trying to remove, have you got any faulty equipments like a faulty hoist, which you need to remove, and can you source a good hoist from maybe from another ward or from the stores, or can you get something? So that's what I'm trying to do. Get the hazard removed altogether. It doesn't happen all the time. So again, substitute the hazard with something safer. So do I need to use something else till I get my equipment fixed? Do I need more people to help me with the task so I can do that safely? Isolate the hazard is when you have spills on the floor, you're putting little signs up, you're getting the cleaners to come and clear the spills. So that's how you would isolate the hazard. And reducing the risk through engineering controls is nothing but you've got the bariatric patient, you may need to move them into a bariatric room, you may need a ceiling hoist. Is that something your manager can facilitate? And all those kind of things would come into engineering controls. And again, level 3 would be reducing the exposure. Where could you find, like if you're unsure of what you have to do regarding a particular task, where do you think you can find the information from? Policies, procedures. So it's an intranet hub which we normally get into to try and access our policies. So everything has got a policy, and you're pretty much safe and you're within guidelines when you follow your policies. And if you're unsure where to access it, always get in touch with the shift coordinator, or the manager can help you with that. The SDN can help as well. And PPE is nothing related to infection control, but this is more having the appropriate shoes in the right environment. If you're handling chemotherapeutic agents, then obviously you need your purple gloves and you need your appropriate kind of gowns and things to protect yourself. So that's where PPE comes. It's got nothing to do with infection control, but this is more from a safety perspective where the PPE comes. Any questions at all on this? No questions? So if I just get you all to stand up. So before we do that, communication is extremely important when you do manual handling tasks. So it has to be, you need a definitive person, someone to lead the task. So whoever is the most proficient person in doing the task would be the person who would be the leader. So they would always stand at the head end, and they need to assess the capabilities of the team as to what they can actually do, how well can they do it. So you position people as to where you think they're more capable in doing. And again, you need to communicate. So normally you move at the count of 3. So you say 1, 2, and you move the patient on 3. This is how you would normally mobilize the patient. So people do use acronyms like ready, steady, go, and things like that. But we try and avoid those. So you move a patient at the count of 3. If I get you all to stand up. It's pretty much posture is very, very important when you do a manual handling task. So it's very important that you always have a wide base when you stand. So the base has to be wide, and you always move. So it needs to be, you've done your lateral lunges. So you always do a lateral lunge, and your weight should always be, your elbow should be close to your hip level, and your movement should all be within this reach. So you never extend, and you never sort of like pull things towards you. So everything needs to be within reach. And again, if you go into your storerooms, you'll have things stocked up Always your lighter things need to be up and your heavier things need to be down. So you may have to get in touch with your manager to reorganize your storeroom to make it easy and comfortable. So I just get you all to do the lateral lunges. So we're trying to move a patient from the bottom or from the top, however you're trying to move. So it's this way. So it's lateral lunges. And if you need to move a patient from a bed to a trolley, it'll be more like this. So you do a forward lunge. Okay? And again, if you just hold a fist and just face the back of your hand, of your back, you can see the curvature on your back, you can feel it. That's how it has to be throughout your procedure. Now, if you're trying to wash your patient, try and keep everything within reach so you're not actually sort of like turning back and extending and rotating, because that can actually cause injuries as well. So whenever you move, you have to move in sort of like 180-degree angles so you can just go and reach your item. Alright, that's pretty much it. So what we're going to try and do is, if you have someone with a spinal injury, or if you have someone who's palliated, who's in pain, and you're trying to move the patient up the bed, or they're even agitated when you're trying to roll them, you can actually use this technique of 2 sliding sheets. Can I get one of you all to come with me to do this, and then I can get you all to practice. I'll get you over there. So for this you need 2 good sliding sheets, 2 new ones, preferably the yellow sliding sheets, but we have the green ones. The reason why we prefer the yellow sliding sheets is because it's waterproof and it doesn't really absorb moisture, whereas the green ones do absorb moisture. So we explain to our patient, we make sure he's all right, we'll tell him what we're doing, and we need to get the bed to a comfortable height. So we normally get, both of us are more or less the same height, so whatever's comfortable for you. Is that high enough for you? Yeah. Do you want to get the bed sides down? You might just move the bed a little bit towards. You might just get the head down. You could have the pillow on. If you don't want to remove it, but otherwise you can do it without the pillow. So I just get the other sliding sheet as well. So it's just in the lengthwise you'll need to put it over the patient. But if your patient's getting agitated and confused, and if they really don't want you to do this, you can actually do it away from the patient as well. So sometimes in the mental health wards it gets difficult when you try and do this on a patient who's already agitated. So lengthwise, you just put one on top of the other, make sure they're equal length. You might get this up a little higher. Again, you need someone leading the tasks, and it's all about communication. So it's one on top of the other. Do you want to come near one? Yes. And then you just go hand length, so you hold on. So that's just a full arm length, and then you just bend it over. So it's 1, 2, 3. And then you go again. It's 1, 2. So just arms length. And again. 1, 2, 3. And you just do it once more. You just hold. And then we face the open end, facing the top. We go under the patient's head. We try and tuck it under the shoulder a little bit. And then we just go like this here. You go under the sheet. You just make sure you hold the open edges. And you just hold the bottom of the other arm. And at the count of 3, we're pulling down. 1, 2, 3. We do it again. So we hold the base. And then 1, 2, 3. And we do it again. Count of 3. 1, 2, 3. And we do it once more. 1, 2, 3. So it's very important that all the pressure areas, like all the points are covered, and the feet also sits under the sheet. Now most of our patients, especially the rehab wards, They could have anticoagulants, so you need to make sure something is there because you never know the strength of your partner. The patient could just go and hit straight on them. So if ever that happens, please report it as well because they could be on anticoagulants. They could have a bleed if that happens. It's happened in Ward 5. So we do the lateral lunges if you need to position the patient, get the patient up, get the patient down, whatever you need to do. So once you've done that, so we'll try and get the patient up a little bit. 1, 2. So once we've done that, we've positioned the patient, we've made them comfortable. We need to take the sliding sheets off, and you don't want to turn your patient. In that case, I just get you to pass me your, just the bottom sheet, just underneath like this. Just give it to me under the patient's neck. Perfect. And then I just walk back. And the patient stays where they still. Just make sure you never put the sliding sheets on the floor because someone can step and have it fall, so always keep it safe. You could do both at the same time if you're need to, but I just do one at a time. So when you walk backwards, always be careful, there's no cords and cables at the back. Did you find that easy? Yeah. So can I get you all to try this? So we'll just pass the back on.
Sometimes you never know.
It's just the
We
color.
talked about it,
the color.
isn't it? And then we bend this over the neck here, not for sure. Cross. No, I'm okay.
You're okay.
I'm used to it. And then again. So maybe one more. Okay. Okay, now flip over. This way, that's it. Over the top. Maybe drop them down a bit.
Oh yeah, he's gone up. Yes.
Under the shoulders. Is that the right way?
Yes, it is. The thing is facing up, isn't it? Yes, it is. And then we just go underneath. So it's just this way. So we go, so just on the top. So we hold the top end. And then we just go underneath.
That's right, so I'm getting mixed up.
And then we just go
Alright,
underneath.
ready? I'm ready. Alright, you ready?
Yeah.
On
So
three.
you hold this line. Just make sure you
And you're gonna hold this on.
make sure you hold the top.
Alright, 1, 2, 3. And take that.
This is something if you don't get it the right way, then it gets
Yeah.
tangled.
Okay, ready? And we'll just go down that. The other one. 1, 2, 3. One, two, three. It's a bit short.
Sorry.
And then we'll move the patient up. Together top.
So we just use the top. So whenever you use the sliding sheet, just make sure you use the top one. the bottom axis is sliding. If you hold both, then it doesn't work together.
Closing 1, 2, 3.
Perfect, well done. So it's very much under control.
You grab that top of me and watch backwards.
So always be aware of your surroundings. No cables or anything. So very often we just fold and we keep it sort of like a foot end, so it's always accessible. Otherwise we put it in the bottom drawer of the patient.
Okay. So just in fact, you get it on your name.
How did you find it? Is it something you could use in the ward? So it's very important we
You
use.
just forget sometimes away.
And it's very important we use two-sided sheets because very often we notice that there's only one-sided sheet being used, and then so normally we have enough in our storeroom, so just make sure that we grab and and get the right colors. So you cannot have two different colors because they work differently and they absorb differently. As long as they're dry, it should be good, but if they're wet, then they don't really slide very well. So just need to make sure, and if they're being overused, make sure you discard them and grab two new ones. We only use sort of like for a single use, not a single use, but for a single patient, and then we discard it. We never put it on the wash or we never reuse it again. That's great. Guys, any questions at all with that? Okay. So the next thing is really, what we're going to do now is pretty much, we've got a fire in the building. So we're going to, so we normally in the case of a fire, we evacuate people who are independent. So if you only do that once the area warden, once the hospital incident coordinator advises an evacuation, or there is an immediate danger to the patient's lives where area warden decides to evacuate. So once you evacuate the building, you never come back. So most of the independent patients, we get them out first, then the semi-ambulant who can sit in a wheelchair, so we get them out. But then in the wards, we have patients who are not very mobile. So sometimes the beds may not pass through the corridors, but most of our beds do. But we do have low to floor beds. So patients on low to floor beds will not be able to be wheeled out. And also the mental health units where you don't have beds with wheels, they can't be wheeled out as well. So we're just going to use a rescue pods. That's when we use rescue pods. It's very important we know where our nearest rescue pods are kept. So in Ward 5, we should have rescue pods. We don't have, but the nearest one would be Ward 12. Again, Ward 4 doesn't have rescue pods as well. But in this building, we've got rescue pods all down the corridor. So this is something we're using for training purpose, but when you grab a brand new one, what you need to do is just release the tape. And then you just hold it like this, and then you just pull it out. So once you hold the red strap and you open it, the whole thing opens up immediately. So when you need to move someone, again, it's quite a scary thing because you have the alarms going off. It normally frightens people when the alarms go off, so you just have to be mindful of that. Explain to them, reassure them. Again, for this procedure, you need to have someone who's competent to lead, will be at the head end, will be talking through and leading through the entire process. So for this, we'll make sure that we take the sides. Who wants to? Are you happy to be the leader? So I think someone speaks that in there. So we'll make sure we take the foot end off. And I'll open the door. And you have to get over here. Has anyone used a rescue pod before? Has anyone evacuated a patient home? Has anyone seen? We do have on EMH's e-learning, we do have a video on rescue pod, which always is a good thing because they show you how to get a patient downstairs and things. So for today's thing, we will have Victoria will stay with me, and I'll just get you both to stay on the foot end of the patient. So once we've opened the rescue pod up, Sorry, this has been used many times, so I'll have to just get it out of the bag. Someone's reassuring, someone's comforting the patient. So it's a pretty So it comes in with a lot of straps. You've got the orange straps, which goes over the patient. So we need to roll the patient. So normally you have the head end. So it's got a little pillow, so that tells you it's the head end of the patient. And then you just open all the ties up. All the velcro. And I just roll it to the side. You're happy to be at the foot end of the patient. So I get you to come around this way. So what we need to try and do is to roll our patient and you slide this under our patient. I've explained to Mark, all good Mark, we're just going to try and roll you. Just get that. And we're just getting back in again. Just need to make sure the head's sitting right, feet on. It does work like a sliding sheet, so we just need to be very careful when we start tipping the bed. So we just put all the straps on. The extra straps can just be stuck on the sides. If your patient has got any IVCs, drains, anything, we just make sure they're all kept inside. Then comes your orange strap. So this normally just slides in, just through there. So you could pop a little blanket or a towel or even a pillow underneath, so it's not too tight on there. It's just a clip, it just clips on, just like that. And then you just cut the remaining outside. So once your patient, so when you hold your straps, so the way you hold your straps will be like this. So pop your hand in, and then just grab on to just one end of this. So when you're like doing the foot end, you need to face that way, so it's easier for you, but you can still look at me as long as you face that way. Yeah. So now what we do is we slowly start tipping the bed. So this is when we need to be aware of the patient, and then we're just going to start tipping the bed. So in the electric beds, you do have a little knob at the bottom, so you'll be able to pull this out. So you should be able to pull the sides out. That will just help you tip and get the patient more closer to the floor. So just tipping, and just to remember, it acts like a sliding sheet, so just need to be very careful. We'll just bring the bottom sheet down. So whoever's at the foot end, whoever's leading, will be running through the whole thing and making sure everyone's happy as we're doing it.
Are we ready? Yes.
It's also good to face the door. So we might. Should be on the ship.
With a chair.
So normally we move it slightly facing the door as well. So just get this down. So we've tried to get the bed as low as we can. So now we're going to do this in a controlled fashion. So once we come to the middle of the bed, we'll slow down so we can get the head down slowly. So we'll be doing this at the count of 3. So you can start moving. 1, 2, 3. Slowly go down. So you're pretty much guiding. So you can let the legs go down slowly. And slowly start taking. So if you really look, and then we can start moving. So we go down. If you have the stairs, you just have to be careful once you hit the stairs. So we do gradual. So whoever's at the head end will have to keep protecting the head. But you all can relax now. So now you all just hold on. Just hold on to the straps and you all can hold. And we go to the right. 1, 2. So that's it. So we go that way and then we come back. You're okay to pull. Yeah. Just turn it. Now let's go back this way.
Sorry, Mark.
Going straight in. Just leaving there. Just leaving there. So pretty much, if you're going down the stairs, you just have to be a little bit careful. And I'll just close this. Sorry, it's a little bit noisy out there. So if you're going down the stairs, the most important thing is whoever is ahead end will have to just control down the stairs, and again at the foot end you all can sort of like move. So it's only when you get the patient off the bed you'll have to have more control, but once they're down you need to look after your back as well. So just make sure you loosen the straps and then you do the pulling. Alright, it's a little more easier, and especially when you have when you go down the stairs, it gets a little more easier. And once everything is ready and once you need to get the patient off the floor and obviously back onto the bed, we use something what you call as hovermat jack to try and get the patient off the floor. Or we may use a hoist. It just depends where exactly are you in the car park. It just depends on, so we leave the patient until it's safe to come back, and then we bring the patient back into the ward. And the only person who can say it's safe to come back would be the fire department or the hospital incident coordinators who can let you come back in. So we just have to wait for that. All good. And so once your patient's ready to come back or go back into the bed, you just undo this. Just take all the straps off, and it's just a similar process again. So we just take all the straps off. We tuck it, and then whatever device we use to get the patient back in. I think we'll just leave them on the floor for now. Any questions at all? So does that? Thank you very much for coming into the session, but any questions, any concerns, anything? So we've just practiced this, and you should always, wherever you work, very, very important to know your fire exits, your evacuation exits, and also, where are the nearest rescue pods if ever you need to move patients out. And again, are they connected to oxygen, and do you need a portable oxygen cylinder? There's multiple things you look at to make sure it's safe to transfer this patient. And just carrying whatever is needed. If there are things like IV drips and stuff, you can disconnect the patient and leave them behind. Do that so you have minimal baggages for the patient. And hope the session was all right, but you do have a video in intranet. If you all need to look at it, please go ahead and look at it. Thank you very much.
Thank you.